A blessed day to everyone. I am Josel Anay Nunag, a first-year nursing student from Our Lady of Fatima University, Pampanga campus. Today, I will demonstrate the proper procedure for giving a bed bath with shampooing, oral care, and back massage. So first is I will review the patient's chart for any limitations in physical activity or if there are any additional monitoring that might be needed throughout the procedure. Okay. Next is I will gather all the necessary equipments onto the bedside table of the patient to ensure a smoother flow of the procedure. So I have already gathered all the materials that we are going to be using with today's procedure. Next is I will perform a proper hand hygiene and wear my gloves to avoid any body fluids from the patient. Okay. Okay, so after performing your proper hand hygiene, I'm going to greet and identify the client and explain the procedure. Good day, sir. I am Giselle, your student nurse from Our Lady of Fatima University, Pampanga campus. And before we proceed, may I please ask for your full name, your age, and your birthday?
I'm Bernal Gilmore, 19 years old, born July 29, 2006.
Okay, so for today's procedure, sir, is I'm going to perform a proper bed bath to you, including shampooing, oral care, and back massage. So, this is to provide a comfort and for your personal hygiene and your overall health. Is that okay with you, sir? Okay, so I'm just going to close the curtains to provide more privacy throughout the procedure. Okay, next is I will offer a bedpan or urinal before beginning the bath to prevent interruption during the procedure. Okay, sir, so I'm just going to put underneath your hips and just tell me when you're done, okay? Okay, so I'm just going to wait for the patient.
Okay.
Okay. Okay, and after that is for the preparation of the patient is I will place a bath blanket over the patient to maintain the privacy and warmth, and after that is I'm going to remove the patient's gown while keeping the patient covered, of course, and I will prepare my water and check for the temperature to ensure comfort. Okay, I'm just going to place or drape you with this towel, sir, and I'm going to remove your gown. Okay, so I want you to move on the side, please. Okay, so I'm just going to prepare the water. Okay, after that is we will now move forward to our facial care. So first thing is I'm going to place a towel across the patient's chest. Okay, after that is I'm going to clear the eyes or to cleanse the eyes first using a plain water with our face towel right here, and I'm going to wipe from the inner to outer canthus, and I will use a clean area of the washcloth for each eye to prevent the spread of any microorganisms. I'm going to dip my face towel onto the bath basin. Okay. Okay, sir, we will now start the procedure within your face, okay? Going to fold the towel onto the clean side. Down to the neck, I'm just going to adjust this line cleaner. And lastly, the ears. Okay. And then after that is I'm going to dry the area. And right after that is we will now move forward to arm and hand care. So of course is I will expose the area and place a towel underneath the arm. Okay. So going to place this underneath your arm, sir. Okay. Then after that, I will wash and rinse and dry the arm using long firm strokes from the distal to proximal areas to promote circulation. Just going to dip my face towel onto the bath basin. And from distal to proximal areas, I'm going to rinse the arm from within long firm strokes. After that is I'm going to pay attention especially for within the skin folds and the axillary area. Okay, for the arms, for the hands, I'm going to dip the hands onto the bath basin, paying attention to the fingertips. To firmly wash it. Okay. Of course, we're going to dry the area with a dry towel. And we're going to do the same thing with the other side of the with the other hand and other arms, but just assume that I already did the same procedure to the other arm because I cannot move onto the other side of the bed. Okay, so after that, after arm and hand care, is I am going to move forward within chest and abdominal area. So just going to grab my towel and dip it to the bath basin right here, and I'm going to lower the blanket exposing only the chest area first, and to maintain the patient's privacy, of course, and I will wash, rinse, and dry the chest area, paying special attention to the skin folds, of course, and I will continue down to the abdomen, carefully cleaning the umbilical area and abdominal folds. Okay? After that, of course, ensure the patient's comfort by folding back the towels. Okay, and after that, we'll now move forward to leg and foot care. So I will expose the far leg and place a towel underneath the leg. So after that is I will wash, rinse, and dry the foot, paying particular attention between the toes. So I'm going to put a towel beneath it first. Okay, I'm going to expose only the leg area. Okay, I will dip my towel onto the bath basin again and do the same procedure on the other leg. Alright, then right after that Okay, so we will now proceed. At this point, we will now proceed with shampooing to promote scalp and hair hygiene. So first is I will place a towel under the patient's head and shoulders and position the shampoo basin properly. Okay. So I'm just going to put on the towel on your head and lift up your head, please. Okay. Okay. So I'm going to prepare my shampoo basin. Okay, so the shampoo is right here. Okay, going to put some water. Okay, and with that, I am going to check for the temperature, of course, to ensure the patient's comfort. And right. Okay, so I will wet the patient's hair and apply shampoo. I'm going to gently massage the patient's hair in circular motion with my fingertips to remove the dirt and stimulate circulation. Okay, after shampooing, of course, is I will rinse the client's hair for deeply. Okay, and after drying the patient's hair, is we will now proceed for the oral care. So we have our toothpaste right here, our cup with water, our toothbrush, and a I will place the patient in a sitting position, in an upright position. So kindly please sit, sir. Okay, say ah. Okay, I'm now checking for the condition of the mouth and teeth, and also the tongue. Kindly stick out your tongue for me, sir. Okay. With that is I'm going to grab the brush and the toothpaste. Okay, so I will brush the teeth using gentle circular motions, including all the tooth surfaces and the tongue. Okay. So sir, kindly say ah. Okay. Ah. Okay. After that is going to grab the water and I will assist the patient. Okay, sir. Kindly spit out. Okay. After that is I will dry the mouth and apply lip moisturizer if needed. Okay, you may now lay on your back. And with that is for the back massage, I'm going to assist the patient into a side laying position while maintaining privacy, and I will expose only the back area of the patient. And first is of course I'm going to wash and rinse and dry the back of the patient and the buttocks area, paying particular attention to the skin folds and pressure points. So I will assess if there are any skin for red as I will assess the skin for redness, irritation, or any breakdown. So okay. Sir, kindly lay on your side, please. Okay. Okay, so just okay. After that, I'm going to remove my gloves and perform a proper hand hygiene again. Use an alcohol. And for the grooming and aftercare is I'm going to assist the patient in wearing a clean gown. So sir, you'll now the procedure is now done, sir. You may please lay flat on your back. And with that is I will groom the patient's hair and provide other personal hygiene measures if needed. And I will ensure that the patient is comfortable. I will raise the side raise in the bed and place the bed in the lowest position as possible and ensure that the call bell or other personal belongings are within reach. Okay, I have to raise the side rails for patient safety, and I'm going to adjust the bed. Okay, so you may now sit, sir, in an upright position, please. I'm going to comb the patient's hair. Okay, after that is I will discard all the materials that had been used, such as the gloves and the bath basin and the towels. And that's it for our return demonstration on assessing the patient and providing a proper bed bath with shampooing, back massage, and oral care.